Youth are the most important actors in their healthcare. When health center staff encourage, acknowledge, and incorporate youth perspectives, they exemplify a healthcare system that values collective input, patient rights, and the holistic success of children and adolescents, ensuring youth have a voice, influence, and a place in their communities. Design thinking is a dynamic approach to problem solving where inspiration, ideation, and implementation are not separate steps, but interconnected phases. This approach helps address complex challenges in innovative ways. Let's break this down. Inspiration. This is where the process starts by understanding the needs, desires, and behaviors of others. Insights are gathered through observing real-world interactions, engaging with stakeholders, and exploring problems deeply. Ideation. Here, insights from the inspiration phase are transformed into creative ideas. This involves brainstorming sessions, sketching possibilities, and pushing the boundaries of conventional solutions. It's all about thinking outside the box. Implementation. This phase overlaps with ideation and focuses on prototyping, testing, and refining solutions based on feedback. It's about making sure the ideas are practical and effective. Engaging young people in design thinking is crucial because they are not just beneficiaries, but key stakeholders in their healthcare. Their engagement ensures services are tailored to their needs and delivered in a way that resonates with them. To engage youth in design thinking involves several key steps. During the inspiration phase, it's important to empathize. Engage with youth to understand their unique needs and perspectives. Understanding their experiences, challenges, wants, and supports sets the foundation for working and learning together. Next, you'll want to define. Determine the goals of the services, programs, or initiatives based on these insights. Clearly articulate the objectives of the services and programs based on their feedback. Next comes the ideation phase, which is just as it sounds, all about ideas. Facilitate brainstorming sessions with you to generate creative ideas and solutions. As you move into the implementation phase, this is where you'll prototype. Preliminary versions of solutions can be created and tested by youth or created with their involvement. Finally, it's time to test. Use feedback from you to iterate and refine these solutions, ensuring they are effective and feasible. As with any partnership, it's essential to establish an understanding and a process for working with youth on different projects. This can include regular meetings, feedback sessions, and involving them in decision-making processes. Beyond creating or enhancing offerings in the health center, the focus should also include youth professional development. Ensure the process includes training opportunities, mentorships, and events that align with their interests and uplift their work. Connect them to peers and adults that can broaden their horizons.
I developed a sexual health education app tailored to adolescents nationwide, encompassing those at health centers. I was actually invited to become a part of this process by a supervisor who saw the value of youth input in specifically tailoring this app. So I felt like this app was something that I was really passionate about, especially because sexual health education is a topic area that I'm really interested in based on what I've seen in my community with regards to the peers who have faced struggles and pressures with sexual health. And I've seen those who have made poor decisions. I've seen those that have made good decisions. And I've just been really, really interested in this topic area. And my supervisor was looking for youth input when developing this app. So I felt like our interests coincided, and I was really, really happy to be a part of this process. Our goal with designing this app was to reduce the rates of unintended teen pregnancies and the transmission of STDs. We came to the realization that many students at health centers, especially in underserved areas, don't have access to education, so STD rates are very high in those areas. So what I got to do was work with my supervisor and her colleagues and some youth over a 6-month period to develop content for the app and make it user-friendly and very inclusive. I got to see the fruition of my specific efforts, as well as like the other youth in the council and my supervisor and our colleagues. And over a 6-month period, we were able to redesign the app completely. We first began by designing our app to make sure the language is very inclusive to people from different backgrounds, because we want to make sure that whoever uses the app feels welcome and safe, and that the app was made for them. Next, we tailored and edited all of the aesthetic elements, which I was able to specifically help with, because youth are able to provide perspectives that some supervisors aren't. For example, I know the way you think, and whenever we're using apps and social media, we don't want to see content and content and content. So therefore, we obviously incorporated pictures as well as videos into designing the app, because this allows it to be very interactive for people who are using it. The next part of our development process was focused on the app's interface and accessibility. What we did was we wanted to make sure that every user who was using the app or utilizing it was able to navigate through the different pages smoothly based on their specific wants and needs, and that they had access to this very important health information that we were promoting. The last aspect of our app was to tailor the specific health education content and make it inclusive. I was able to see over 6 months the culmination of our work, and the app changed completely. And it was a really, really good process because I loved working with my peers. I did a separate passion project with my supervisor on the side just because I was interested in it, on assessing the association between teen partner support and contraception use. And we presented at a conference. So I found that really, really fun. With regards to the specific design process of the app and the way everything was set up, we had 2 supervisors from different locations and different colleagues. And I had 3 to 4 youth helping me and the supervisors design the app specifically. The way it was run was a little bit unconventional because we had recurring meetings every week, but the youth worked on the project at the same time, doing the same things. We didn't allocate different jobs or different tasks to youth members. What we did was us youth, we worked on designing the app at one time on a Zoom call. We would design the app. We would each write our specific feedback based on what we thought needed to be changed or what we liked. And then we came together and discussed. I feel like this is a very, very important way to do it, rather than disseminating information or delegating tasks to youth specifically, because doing it this way allows for, one, a more comprehensive input on like the app development, because you have more than one set of eyes looking at it. Secondly, it allows for more discussion. And thirdly, yes, there will be some arguments or there will be differences in opinions, which is good, because that really, really allows for youth perspective to be incorporated in the app. And even though some people may agree on something and some may differ on something, that allows you to really think about those ideas. And I felt like that process really, really helped facilitate the app and was really efficient, actually. Another thing is that I felt like I had support from my supervisor every step of the way. And with regards to health centers, specifically reaching youth and having a supervisor taking on the role of like a mentor, it's really, really important to follow some key things. One is for a supervisor to clearly state their objectives with regards to what they want the youth to do and what the program is about. And this ties into my second point about transparency specifically. It's always helpful for us youth to know exactly how we're making a difference, because we want to make a difference, but we want to know exactly how through the program's initiatives. So having transparency, and the supervisor usually provides this transparency, but having transparency about the specific goals of the program is very important. Another thing is to always make sure that the youth feel like their feedback is valued and as important as the supervisors. And lastly, the supervisor, if they're always available for contact via email or phone, it's always, always best. That's because it really allows the youth to ask questions if they're struggling or really get to know more about the process. And so I was overall really, really glad I got to be part of that project.
By incorporating design thinking into the health center's services, service delivery is not only improved, but transformed. This approach can produce innovative, effective solutions that deeply resonate with adolescent patients, encouraging them to shape their healthcare experience. Say you want to reach more of your adolescent patients to complete their annual well visits. With a design thinking approach, you would want to understand why adolescents might miss their annual well visits. This could involve talking to youth and those in their lives, like family members, health center staff, and community leaders. Based on these insights, brainstorm solutions. Ideas might include flexible scheduling, mobile clinics, or text reminders. Consider creating a youth advisory council that conducts outreach campaigns to raise awareness, or a peer ambassador program where teens encourage each other to schedule and attend their visits. From here, prototype the solutions. For instance, test a pilot program with flexible hours or peer ambassadors in partnership with a nearby school. Gather feedback from participants and refine the approach based on what's learned. Design thinking is a powerful tool health centers can harness to demonstrate commitment to youth, not just as recipients, but as active co-designers in their healthcare journey. When facilitated in partnership, incorporating a youth-centered design thinking approach can enhance the quality and experience of healthcare services and programs to better serve youth. Learn more about design thinking approaches to healthcare programs and check out the other videos in the Creating and Sustaining Adolescent-Centered Health Programs series.